All right. So welcome everyone. I'm so happy that you are all here virtually today. Um, I will be providing an Eating Disorders 101 style presentation for caregivers, meaning anyone who is supporting someone with an eating disorder or disordered eating. Um, I want to just start by saying that this webinar is for information and education purposes only. It's not a substitute for individual medical or mental health advice. The content outlined in this webinar is also not intended to describe everyone's experience. We acknowledge that all individuals and families and situations are different and that everyone knows themselves best. So this presentation is meant to generally describe eating disorders and to provide general recommendations, but know that it is not meant for specific situations or advice. Again, just to reiterate a couple of housekeeping items, we ask that you keep yourselves muted during the presentation. If you do have a question, you're welcome to send it at any time in the chat to Kelsey. I will also pause throughout the presentation at various points to answer questions, and at that point you are welcome to unmute yourself and ask a question verbally, or you can send it in the chat to Kelsey, so whatever you would like. These slides will also be shared after the presentation. You will get an email right at 11:30 with a link to the slides. And as I mentioned, this webinar is being recorded, and we hope to be posting it on YouTube following the webinar. So in terms of an overview of what we'll be talking about today, if at any point there are any issues with seeing the slides or anything like that, just please let Kelsey know as well. So I will start with a brief overview of Sheena's Place and my role there. I will then review the types of eating disorders, some signs and symptoms, prevalence and severity information, and then bust some common myths about eating disorders. I'm then going to talk about recovery and treatment. So that includes the types of treatment that exist and therapy modalities or types of therapy. And then we'll end with strategies for supporting your loved one during this difficult time. And then at the very end, I have several lists of resources, both for folks with eating disorders and for caregivers and loved ones. I also want to point out before we get started that this presentation is meant for caregivers and loved ones of anyone with an eating disorder, but I will say that at Sheena's Place, our focus is on older adolescents and adults, and so there is more of a focus on that population. Okay, so Sheena's Place. I know some of you may be familiar with us, but some of you may not be, so I'll go over what we do. Sheena's Place is a community mental health charity located in Toronto, Canada, that supports people with eating disorders, body image issues, and concurrent mental health challenges. So we offer a wide range of professionally facilitated groups and workshops to people affected by eating disorders, as well as to family, friends, and partners of those with eating disorders. So we provide 5 main types of groups to people at all stages of recovery and to those who are ages 17 and older. So our 5 main types of groups include support groups, expressive arts groups, skill building groups, body image groups, and nutrition groups. When it comes to caregivers and loved ones, our main type of group is a general support group. So we offer, as I mentioned, a weekly support group to family, friends, and partners, which was on hold because of COVID-19. But I am happy to announce that it will be starting again virtually next week. And I'm going to talk more about this at the end, about how to register and get involved if you would like to. So all of our programs at Sheena's Place are free of charge, and an eating disorder diagnosis is not required to attend, and a referral is not required. So it's all based on self-referral. To register for our groups, as I mentioned, you must be at least 17 years old. That applies to both caregivers and folks with eating disorders, and you must be a resident of Ontario. We receive no government support at the moment and rely completely on private donations. And lastly, my role at Sheena's Place is to facilitate support groups, now virtually, and also to provide presentations and trainings to a variety of audiences, including medical and mental health professionals, university students, elementary and high school students and teachers, as well as corporations and community members like yourselves. All right, so getting into eating disorders. I'm not going to go into detail about all of the diagnostic criteria for each eating disorder, but I will give a brief overview. So essentially, an eating disorder is a type of mental illness in which a person has a negative relationship with food that is harmful to both physical and mental well-being. So the eating disorders in purple are official diagnoses according to the DSM-5, or the Diagnostic and Statistical Manual. And the blue ones are not official diagnoses, but I still want to talk about them. So to start, binge eating disorder involves engaging in episodes of binge eating. So that means eating an objectively large amount of food in a discrete time period and feeling a real loss of control while doing so. So binge eating, isn't about just eating past the point of fullness or having seconds or thirds of your favorite meal. It's really about this feeling of being out of control around food. And folks with binge eating disorder do not engage in any kind of purging or compensatory behaviors. And binge eating disorder, also known as BED, is the most common eating disorder. Bulimia nervosa is another eating disorder that's characterized by a cycle or cycles of binging and purging. So purging essentially means an attempt to compensate for the binge eating episode through means like self-induced vomiting, laxative or diuretic misuse, excessive exercise, or fasting. Anorexia nervosa is another one that you have likely heard of, and this involves an intense obsession with restricting and controlling a person's eating. So those three are the three that we often hear about the most, and they are the most common. However, there are a few others that I do want to mention. So pica is the persistent eating of non-nutritive substances or non-food substances. And this can occur for anyone, but it is a little bit more common during pregnancy and among kids with developmental disabilities. Avoidant restrictive food intake disorder, or ARFID, is another eating or feeding disturbance that essentially means that a person is failing to meet their nutritional needs from food. And so the symptoms can look a lot like anorexia, but the main difference is that for ARFID, the restrictive symptoms are not about body image or fear of weight gain. It's more about an intense, fear or avoidance of specific foods or textures, and it looks like really picky eating. And this isn't to say that everyone who is a picky eater has ARFID, but it is a very extreme version of that. And it is more common in children, but it can occur for folks of all ages. Rumination disorder is the repeated regurgitation of food, and this is not the same as purging, so that it is different. Other specified feeding or eating disorder is a category that kind of captures behaviors that cause distress and impair functioning, but that do not meet the full criteria for some of the other diagnoses. So one example of this is atypical anorexia, which essentially means that a person is displaying all of the symptoms of anorexia, but they do not have a weight that is below the cutoff for anorexia nervosa. And ironically, atypical anorexia is actually more common than regular anorexia nervosa, and we'll talk a little bit more about that later. Another category is unspecified feeding or eating disorder. So like OSFED, it essentially is when the full criteria for an eating disorder are not met. So that encompasses the DSM diagnoses, but a couple of additional ones I want to mention. First, diabulimia. So this is a form of bulimia nervosa that's specific to individuals with diabetes who purge through the misuse of insulin. And this can be really dangerous and can often be overlooked in the diabetes and eating disorder worlds. Another unofficial diagnosis is orthorexia, and this is something that is becoming increasingly prevalent, and essentially it is an obsession with healthy or clean, quote unquote, clean eating, often accompanied by compulsive exercise. So I'm sure you can imagine living in a society that really values certain eating behaviors and exercise behaviors. It can be quite hard to tell when certain behaviors move from healthy or helpful into this orthorexic category, but that's something that more and more professionals are focusing on as we see it pop up more and more. Okay, so moving on to some of the signs and symptoms. So like all mental health challenges, eating disorders occur on a spectrum. So we all fall somewhere on the spectrum. All of us in this webinar, myself included, are somewhere on the spectrum, and that can change over time and depending on context. So I really want to emphasize here that some people are going to fall kind of within on the right side of the spectrum and have a diagnosis. And some people are going to live more in this middle section of what we would call disordered eating. So meaning they're experiencing symptoms, but they don't meet the full criteria. And just because someone does not have a diagnosis doesn't mean that they aren't worthy of treatment and support. So everyone who experiences eating disorder symptoms, regardless of if they have a diagnosis, deserves treatment and support. And early intervention is actually associated with greater chances of recovery. So we really want to support someone when they are starting to display some of these symptoms and not necessarily wait until a diagnosis happens. So below you'll see some behavior and physical changes that can be associated with disordered eating symptoms. So I'll give everyone a chance to read through that just for a couple of minutes, and then I'll pick up from there. So here I want to emphasize that a person may exhibit some of these changes, or they may exhibit none of them, one of them. So it's really going to look different for everyone. And because there's often a lot of stigma as well as feelings of guilt and shame associated with disordered eating symptoms, folks may go to great lengths to hide some of these signs and symptoms. So they may not be as evident as you may expect, and that's often due to both stigma and guilt or shame. And I also want to point out that these signs don't necessarily mean that someone has an eating disorder. So for example, irritability or loss of interest could indicate something entirely different, as could gastrointestinal problems or fatigue or those sorts of things. So I don't want this to be a diagnostic list. It's really just a list of some potential signs. Oh, I'm seeing that the bottom is cut off. Okay, let me see if I can fix that. Hold on. Is that better? Can you see the full screen now? Okay, let me know. You're welcome to chat, Kelsey or everyone, if there are still problems, and we can fix them. Okay, so when it comes to prevalence of eating disorders, unfortunately, eating disorders are incredibly common. So close to 1 million people in Canada meet the diagnostic criteria for an eating disorder, and that does not account for the folks who are in that middle section. So I'll go back here, this middle section of disordered eating. So many, many more people are facing symptoms of an eating disorder that are often quite distressing and can cause quite a bit of pain and harm. In terms of severity and health complications, we do know that anorexia nervosa has the second highest mortality rate of any psychiatric disorder. So it's second to opioid addiction. And leading causes of death for eating disorders in general are suicide, as well as cardiovascular failure due to caloric restriction, use of diet pills and laxatives, and self-induced vomiting. So these are some of the symptoms that can cause the most harm. In terms of mortality and health consequences, more and more research is showing that these things are actually not dependent on a person's weight. So we used to think that if someone was severely underweight or very, very thin, that they were at a higher risk of experiencing some of these negative consequences from their eating disorder. But it turns out that these consequences can be just as severe in folks of all sizes. So I'm going to pause here for a moment because I know that was a lot of information just about the basics around eating disorders. So I'm going to pause to see if anyone has any questions at this point. I'm muted. Okay, if you think of anything, feel free to send it to Kelsey. So we will move on to some of the myths about eating disorders. Oh, I see a question now. Being cold. Okay, so I should have prefaced all this by saying I am not a medical doctor. I am a social worker, so I do focus more on the socio-emotional, you know, factors around having an eating disorder. But in terms of being cold, that sign is likely, it's most likely associated with caloric restriction. So if you're not feeding your body enough and your body doesn't have enough energy, then your body may feel cold all the time. And I'm sorry, I can't get into more details around the biology or physiology of that, but that sign is associated more with restriction. I also know that a consequence of binging and then purging is electrolyte imbalances, and electrolyte imbalances have a lot of consequences for the body. I don't actually know the specific details of all of those consequences, but temperature could be one of those things. So I hope that answers that question. Okay. So moving on to some common myths about eating disorders. The first myth I want to address is how eating disorders develop. So there is an assumption or stereotype sometimes that eating disorders are a choice and that they may represent a diet gone too far or a cry for attention. But in reality, like all mental health challenges, the causes of eating disorders are biopsychosocial. So that means that individuals may have a genetic or a biological predisposition, and then environmental factors can trigger or induce symptoms. And this is different for everyone. So some biological factors can include genetics, physiology, medications, and neurochemistry. So for example, we know that some twin studies have shown genetic correlates when it comes to anorexia and bulimia. We also know that medications may influence appetite or weight, which can then influence how someone engages with food or their body image. There's also a bidirectional relationship between anorexia nervosa and gastrointestinal diagnoses. And this one's a little bit tricky. The research it's unclear what comes first. So it's a little bit like a chicken or the egg situation, in that we don't necessarily know if anorexia leads to GI diagnoses or vice versa, or both, but it is an interesting relationship. A recent study also linked anorexia to infections like strep. And so this specific study that was published in 2019 showed that those with anorexia were more likely to have mutations in genes responsible for controlling metabolism. And so just an interesting intersection where we don't necessarily know why this exists, but further evidence that there may be some serious biological factors associated with the development of eating disorders like anorexia. When it comes to environmental or social and cultural factors, this can include family and peer influence, so the environment in which a person grows up and the messages that they're receiving about bodies and about food, societal beauty standards and pressure as well, social media and living in a culture of constant comparisons. There's more and more research showing that exposure to photo-based social media can lead to the development of negative or poor body image, which is then a large risk factor for the development of an eating disorder. We also know that major life transitions play a role. So whether that's entering adulthood or becoming pregnant or experiencing grief or a loss. And I really want to emphasize here, when we talk about environmental influences, to remember that it is an intersection of all three, so biological, environmental, and psychological or individual, and no one person or family is to blame for someone developing an eating disorder. And I know that's a theme that can come up a lot for caregivers and loved ones, but I really just want to emphasize that there is no one cause or one person that causes an eating disorder. When it comes to psychological or individual factors, personality traits, so certain traits like impulsivity and perfectionism have been connected to the development of eating disorders, as well as emotions and attitudes. So for example, poor self-esteem and negative body image, as well as stress management and emotion regulation. So how we regulate our emotions, we all do this differently. And for some people, this is done through eating disorder behaviors. We also know that the vast majority of people with eating disorders also experience additional mental health challenges. So most commonly, this is depression, anxiety, and then followed by OCD, substance use, and post-traumatic stress disorder or experiences of trauma. So an eating disorder rarely occurs in isolation. There's usually something else going on as well. So the next myth that I want to address is how eating disorders are kind of maintained over time. So again, there is this myth that eating disorders are exclusively about food, about weight, about striving for weight loss or to be thin. And while that can be part of an eating disorder for a lot of people, it is certainly not the full picture. And in some cases, that has nothing to do with the eating disorder. So here I have listed some of the maintaining factors or the functions that an eating disorder or that symptoms serve. So again, I'll give everyone just a moment to read over those. And I invite anyone to, if you have a specific question or if you'd like more information about one of those, to send that in the chat. So I can point out a couple of them in the meantime. I know it can sometimes be, nerve-wracking or uncomfortable to ask about a specific question like this. One that I want to highlight is coping with negative emotions. So this is something that's very, very common, especially with symptoms like binge eating. So binge eating is often preceded by feelings like loneliness, sadness, anxiety. And so binge eating can often serve as a way to cope with negative emotions, and other eating disorder symptoms can do so as well. Are there any others? I'll turn it back to everyone. Are there any others?
Hi, I have a
Hi.
question.
Yeah, go ahead.
So it's possible a person can have multiple eating disorders, right? Like it can be a binge disorder and binge eating disorder, and then all of a sudden it's anorexia, and then it's bulimia, and then it's all of that.
Yes, that's a really good question. Thank you for asking. So definitely, a person their symptoms can change over time. And so at one point in time, they may experience certain symptoms or have a certain diagnosis, like anorexia, let's say, and then this might change depending on what's going on. And sometimes this can reflect different attempts to cope with similar underlying issues, or maybe different things are going on in the person's life. The next slide, actually, I'll touch upon one of these ways in which a person may shift from restricting to binging, which is a really, really common trajectory.
Thank you.
You're welcome. Are there any other questions about any of these functions of an eating disorder, or any that are surprising?
Question about the colors. So you color different behaviors with different colors. It has a meaning, or is just
No, no, it's just aesthetic.
okay,
No
thanks.
meaning behind that. Yeah, thanks for asking.
Okay, thanks.
Another one that is common can be maintaining control. So that's something that's coming up a lot right now in the face of COVID-19, and I'll talk a little bit more about that towards the end. But when someone feels like they don't have a lot of control over what's going on in their life, engaging in eating disorder symptoms can be a way to feel like a person is in control, at least in the short term. Okay, and safeguarding against failure, great question. So similarly to maintaining control, for some folks who might feel like they don't have a lot of successes or they are failing at things in their lives, sometimes an eating disorder can provide a way to feel like a person is accomplishing goals. And so a lot of, some symptoms can be quantifiable. And so this can provide a way to feel like, okay, well, at least I'm good at my eating disorder if I'm not good at other things, or if I feel like I'm failing at other things. So that's related to self-concept as well. So for a lot of folks, the eating disorder can become a big part of their identity if they feel like it's something that they're good at, or it's even like a friend. Thanks for asking. I'll give one more opportunity if anyone wants to ask about any of the others. Okay. So moving on. Oh, did someone unmute themselves?
Yeah, I just
Yeah.
say it's a funny thing that most of the movies that have this image with a girl that's very sad and start eating ice cream. That's what I keep in my mind. The watching movies, eating ice cream, binge eating when you are depressed or when you are very low emotionally.
Yeah, that is a very common narrative that we see. And I think that's an interesting one because that can sometimes pathologize or problematize emotional eating. So emotional eating is a very normal part of eating. So, when we're sad, if we want to eat something that might make us feel better, inherently there's nothing wrong with that. And that isn't necessarily the same thing as binge eating. So as I mentioned in the beginning, binge eating is really this feeling of being out of control. And whether, movies, I think, portray both of those things. But that's interesting that, yes, that's one narrative that we do see a lot in the media.
Okay, thank you.
And to your point too, I think it is often women, and I'm going to actually touch upon that in a couple of slides about who is affected by eating disorders. So before getting to that myth about who is affected by eating disorders, I want to talk a little bit about something called the restrict binge cycle. So this kind of goes along with the theme of how eating disorders can develop or be perpetuated. And this doesn't apply to everyone, but it does apply to a lot of people with eating disorders, and also a lot of people who don't identify with having an eating disorder, but do have a complex relationship with food in their body. So a lot of people feel stuck in this cycle of dieting or restricting and binging. And so this often begins as a result of living in a world where we are told that, we need to lose weight in order to be healthy, and that if we don't lose weight, we aren't trying hard enough and that it's our fault. So this belief that thinness equals health causes a lot of people to diet. So it's a very culturally normal thing to do, actually. And when I say diet, I mean not just subtle lifestyle changes, but extreme dieting in which a person is either cutting out full categories of food, or they're significantly reducing the quantity of food they're eating, and their nutritional needs are not being met. So this extreme dieting usually causes a person to experience cravings and a feeling of being out of control around food. So this is the body's way of telling us that we should be eating. So it's actually, the body's really smart when it does this. And then this can often cause individuals to, quote unquote, break the diet, or to binge, or to overeat, so eating past the point of fullness, which is then often followed by feelings of guilt and shame about maybe like not being good enough or not having enough willpower, feeling like they were the ones that failed. And I really want to emphasize here that binging is a very natural biological response to restriction. So when the body interprets extreme dieting and restricting as though we're going through a famine. And so then when food becomes available again, it makes sense that the body wants us to eat as much as possible in order to prepare for the next famine. And so to the previous question about symptom profiles changing over time, this is a very common way in which symptoms can change. And this cycle can happen at much different, like at different speeds for different people. So this might happen within a day for some people, or it might happen for like months at a time. So maybe someone is restricting or dieting for months and months, and then the binging kind of starts happening. And so it really depends on the person and their individual psychological and biological components, but this is a very common cycle. Something else that I want to mention before we go on to the next slide is a framework called Health at Every Size. And so at Sheena's Place, we operate according to this Health at Every Size framework. And according to this framework, body weight is not an accurate indicator of health. So someone in a large body can be healthy or unhealthy, and someone in a small body can be healthy or unhealthy. And based on a growing body of research, we also know that dieting does not work long-term, and this is because of something called set point theory. So according to set point theory, our bodies have a set point when it comes to size and weight that is primarily determined by genetics. And when I say set point, I mean a range of weight. It's not like to the pound, it really is a range. So if we try to change our set point by dieting, so if we try to lose weight below our set point, it may work in the short term, so you might lose some weight, but once we dip below our set point, our bodies will fight back. And so this will happen through either those food cravings or engaging in binge eating. Our bodies will also slow down metabolism and absorb all possible nutrients from the food that we're eating, again, in order to prepare for what it thinks is a famine. So this means that over time, our set point might actually increase because biologically that's better because we're getting enough to eat, but it won't decrease. And this is why that research shows that diets can actually lead to weight gain long-term rather than weight loss. And I should mention too that this research is for the vast majority of people. It does not apply to 100% of people, but it is more and more becoming clear that weight is not connected to health in the way that a lot of us were taught for a long time, and that dieting long-term does not work in the way that many people hope that it will. Are there any questions about the diet or restrict binge cycle and health at every size? All right, no questions yet. You can take your time to think about it. All right, so our final myth about eating disorders is who is affected. So I think this is a very common stereotype and representation that we see of eating disorders in the media, so that an eating disorder affects young, thin, white women. And this group is certainly affected, as are all types of people. So I'll talk briefly about a few different underrepresented populations when it comes to eating disorders. I want to preface that by saying that I am not a part of a lot of those groups of people. And so I don't mean to speak on behalf of anyone else, but I'm really just speaking to the research that I have read and the anecdotal stories that I've been told from the clients who I serve at Sheena's Place. So when it comes to race, people of color are actually just as likely, if not more likely, to present with eating disorder symptoms. And they are also less likely to receive treatment and support for eating disorders. So some possible reasons for that include experiencing discrimination and the stress of that and coping with that, as well as body image challenges as a result of Eurocentric beauty standards. So of course, this is only in certain contexts, but that is something that has come up in the research about race and eating disorders. In terms of body shape and size, so this is something that we've talked about a little bit, we know that people of all shapes and sizes are affected by all types of eating disorders. So there is this stereotype often that if someone is thin and has an eating disorder, it must be anorexia, and if someone is large, it must be binge eating disorder. but this is certainly not the case. Because of set point theory and everyone's individual, who they are as people, their weight is going to be affected differently by different symptoms. And so I mentioned at the beginning something called atypical anorexia. So this sub-diagnosis where someone meets all the anorexia criteria except for weight loss. And so this is something that is often, unfortunately, overlooked in the medical setting. We know that from hearing from a lot of clients, unfortunately, that their restrictive symptoms are almost being reinforced by medical professionals who really emphasize weight loss and see that as the solution to everything, even when this person might really be struggling with the restrictive eating disorder. So just something to keep in mind regarding the assumptions we make about people and their symptoms and what they look like. Another population that we don't often talk about is men. So we know that actually between a quarter and a third of people diagnosed with eating disorders are men. And the rates of subclinical symptoms, so those disordered eating symptoms, not the diagnoses themselves, this is actually equal between men and women. So this is not something that's often talked about. There's a lot of stigma, particularly for men who have eating disorders, and men seek support and treatment less frequently than women, and they're also diagnosed by medical professionals less frequently. In terms of gender and sexual orientation as well, we know that people who identify as LGBTQ+ are more likely to develop an eating disorder than cisgendered heterosexual individuals. And this is especially true for trans and non-binary folks. So they develop eating disorders at a much, much higher rate than cisgendered individuals. And some possible reasons for that include experiences of discrimination, oppression, bullying, and harassment, as well as the inability to meet certain gendered body image ideals within specific contexts. So the relationship between gender identity and eating and body image can be really complex for a lot of folks. In terms of socioeconomic status, we know that people who are living in poverty or who experience food insecurity are also more likely to experience eating disorders and disordered eating symptoms than people who are in higher socioeconomic brackets. Again, some possible reasons for that include the stress of experiencing financial insecurity. So if disordered eating symptoms are a way of coping with that, then stress of poverty or food insecurity can exacerbate symptoms. And also food insecurity itself is linked to disordered eating. So just like when we looked at this cycle here, I was referring to restriction or more intentional dieting. The same cycle applies to folks who are engaging in unintentional restriction. So when people don't have access to food, this can really alter their relationship with food when it becomes available again. So we know that symptoms from restriction, binging, and purging are all more common among folks who experience food insecurity. When it comes to age, we know that adolescence and early adulthood are the most common age of onset for an eating disorder, but symptoms may appear earlier than that, and they often persist into adulthood. So eating disorders are often chronic, especially if not addressed or treated early on. But that being said, folks at all ages can and do recover from an eating disorder. These assumptions and stereotypes in general can be incredibly harmful around who is affected because they can prevent those who don't fit the stereotype from receiving support, either because they don't self-identify as needing support and don't feel comfortable asking, or because health professionals are less likely to recognize symptoms. So I'll pause again here to see if there are any questions about who is affected by an eating disorder. Okay. All right, so I know so far this presentation has been a little bit dark, a little bit sad with some pretty, unfortunate numbers and statistics. But I now want to focus on recovery. And I want to emphasize that recovery does happen, and it can happen for many, many people. And recovery looks different for every person. Um, and despite the severity of eating disorders, we have seen people make a full recovery. So for everyone, recovery is going to look differently. But for many people, we know that it can include maintaining a healthy weight relative to set point, not to BMI, developing more regular, attuned, and intuitive eating patterns. So listening to hunger cues instead of external rules. Restoring body image. So feeling, even if we're not going to get to a place where we love our bodies, at least feeling a little bit more comfortable in our bodies. And also developing alternative and healthier coping skills. The most effective treatment programs have been shown to include psychotherapy, nutrition counseling, support groups. So for a lot of folks, the combination of individual and group support can be helpful, although some people have a preference for one over the other. And in terms of psychiatric medication, there is no medication that has been shown to be particularly effective in treating an eating disorder directly. However, as I mentioned earlier, eating disorders often co-occur with other mental health challenges. So medication can help concurrent challenges. So for example, anxiety, depression, and ADHD, medication may help those, and then in turn that can help reduce eating disorder symptoms. When it comes to nutrition counseling as well, I just want to mention that it's important that a dietitian or a nutritionist is eating disorder and health at every size informed. There are a lot of dietitians and nutritionists out there who are really, really well-intentioned, but who unfortunately can actually perpetuate disordered eating for a lot of folks by prescribing specific diets, and focusing still on weight loss when we know that that is not a helpful goal. Okay, and I like this image too because, you know, often we expect and hope the recovery is going to be an easy and simple path, but often it is a lot more complicated than that. Okay, so in terms of treatment environments, there are a few different types of treatment. And some of these are more accessible to certain people than others. So I'll give a very brief overview, and I will again direct everyone to where to find more information about all of this at the end. So outpatient settings are for individuals who are medically stable, and this usually includes weekly therapy appointments, could be with a psychotherapist or social worker or a dietitian, that sort of thing. And this is sufficient for most individuals and families. This can take place in a hospital-based setting or in a private setting. Inpatient care takes place in hospitals, and this is for individuals who are experiencing high-risk medical complications or who need 24-hour care for medical stabilization. And so often inpatient care will include refeeding and nutrition restoration and symptom interruption. And these are staffed by multidisciplinary teams. So you're going to have doctors, psychiatrists, nurses, social workers, dietitians, a whole range of individuals. Day treatment programs are kind of in between inpatient and outpatient. So these are for individuals who are medically stable and don't need to stay in a hospital setting overnight, but for whom outpatient is insufficient to reduce symptoms. So usually day treatment programs involve attending a program 5 days a week from breakfast to dinner. So the person would eat all 3 meals and their snacks at the day treatment program and then go home to sleep. And these can take place in hospitals or in private treatment settings. Residential treatment settings are also for individuals who are medically stable, but for whom outpatient and day treatment has been unsuccessful in reducing symptoms. So this is a setting where someone does stay overnight, so it is 24-hour care, and it includes some aspects of inpatient care, but it's not in a hospital setting. So often these are private programs that are quite costly. There are a few subsidized or free or low-cost residential programs, but they are a little bit less common, especially in Canada. And lastly, community programs. So these involve anything from group support or individual group or peer support, either in person or virtually. So Sheena's Place would fall into this category of community programs, particularly group support. Okay, so moving into types of therapy that are used to work with folks with eating disorders. And this is not an exhaustive list. So these are just a few modalities that have the most evidence for them. So the most evidence-based modality is family-based therapy, also known as the Maudsley method. However, this is for quite a limited population. So specifically, this modality is intended for adolescents with anorexia or anorexia-like symptoms, and it involves intense parental or guardian involvement. And so, of course, this is not going to be applicable to a lot of folks with eating disorders, but this has been shown to be the most evidence-based modality for that population. Another evidence-based modality is cognitive behavioral therapy. So there has been a version of CBT developed for folks with eating disorders called CBT-E. And this is the first line treatment for adults with bulimia nervosa and binge eating disorder, or those types of symptoms. So in CBT for eating disorders, this involves helping a person reevaluate their thoughts about their weight and shape and self-image, reducing negative feelings or harmful behaviors like dieting, binging, purging. But I will say that CBT is not recommended for people who are severely malnourished. So folks with anorexia or anorexia-like symptoms, because cognitive processing abilities can be really impacted by the eating disorder, and then that person's ability to engage in therapy will not be as successful. So it's really important that a person is nourished properly before they engage in CBT. Dialectical behavior therapy is another really promising treatment modality. So traditional DBT helps a person regulate their emotions and interrupt symptoms by teaching them distress tolerance skills, mindfulness. So how can a person, identify their triggers and then learn new coping skills? And a lot of our clients have done DBT in treatment settings and also through DBT skills groups that we offer at Sheena's Place. And this seems to be a really popular form of therapy. I'm seeing a question about CBT. Yeah, so I can quickly reiterate around CBT. So this is the first line treatment for adults with bulimia or binge eating disorder or those types of symptoms. It involves a lot of cognitive processing, and so it's not recommended for folks who are severely malnourished due to anorexia or anorexia-like symptoms, because their brains can be so impacted by the eating disorder. They're not able to necessarily process cognitively what the therapy would require, and so it's recommended that a person is nourished before they engage in CBT. I hope that helps. Another form of dialectical behavior therapy that is a lot newer is called radically open DBT. And there is not a ton of research on this so far, but there are a few studies that essentially show that this form of DBT can be successful in addressing what's known as over-control. So while traditional DBT can help someone with impulse control, which is known as kind of being under-controlled, a lot of folks with more restrictive eating disorders, the problem isn't impulse control or emotion regulation. It's actually the opposite in terms of reducing rigidity and increasing flexibility in thinking and in behavior. So radically open DBT has been shown to help folks increase flexibility and decrease rigidity and perfectionism, which again are traits that are more commonly associated with anorexia. And, I don't want to be categorizing people necessarily into these boxes because people are so much more complicated than that. But those two types of DBT both show a lot of promise. Okay, I see a question about treatment, and I will get to that momentarily. The last two types of treatment on this slide, they're in light purple instead of dark purple. This one is intentional because they do not have much specific evidence when it comes to eating disorders. However, more anecdotal and case studies have found that incorporating elements of these types of of these types of therapy can be helpful with eating disorders. So motivational interviewing is used for folks who are encountering a lot of ambivalence towards change and recovery. So often this is related to substance use, but it can also be applied to eating disorders. So I'll talk about this in a little bit, but often we see a lot of ambivalence towards change for folks with eating disorders because symptoms are serving so many different functions. And so motivational interviewing can help someone examine sort of the pros and cons of changing versus not changing and help increase that motivation to change. And then lastly, acceptance and commitment therapy. This is based in CBT and mindfulness, and this modality can be effective with eating disorders, particularly with improving body image, because it focuses a lot on looking at what our values are and how we can live more in line with our values. Okay, so I will just take a look at what the treatment question was about. So the question is, what does treatment involve? And I'll be quite transparent with everyone because I work at Sheena's Place. We do not provide treatment for eating disorders. We provide group-based support, which can be an element of a person's treatment or therapeutic plan. So treatment will look different, again, depending, I'll go back to this slide, depending on which environment treatment is taking place at. So, you know, inpatient care is going to be the most intensive, and outpatient or community programs will be the least intensive. What I can say is that often treatment involves a variety of different components. So like what's on this slide here, a combination of psychoeducation, so learning about eating disorders, psychotherapy or talk therapy, which involves any of these on this slide, as well as support groups. So even hospital-based programs usually do have group-based support or therapy, as well as dietitians or nutrition counselors. And like I said, sometimes medication can be helpful for the concurrent mental health challenges. I hope that was helpful. And again, I'll provide more information about where to get more information about this at the end. Okay, so moving on to eating disorders and COVID-19. So initially when I created this presentation, it was before all of this had started, when I was intending to do this in person at Sheena's Place. But since then, of course, a lot has changed. And so I thought it would be helpful to include a slide about how COVID-19 may be affecting some folks that you know or support with eating disorders. So this is certainly not an exhaustive list. And even since I made this slide, more things have come up in the groups that I run at Sheena's Place. But some of the common themes that I'm hearing, first of all, I'll just say that it is really understandable and common that eating disorder symptoms are increasing at a time like this. It is a time of a lot of uncertainty and stress. And so I just want to normalize that if that's something that you're seeing with people in your lives. So one common theme that's coming up is this feeling of a loss of control. So in a situation where there's a lot of uncertainty, we don't necessarily know what's going to happen and when it's going to end, it makes sense that a lot of individuals are turning to food or exercise as a way to feel in control. A loss of structure and routine is also can be a trigger for symptoms or can exacerbate symptoms. So for a lot of folks who are pursuing recovery, structure can be really important. So whether that's meal times or just structuring the day in general with school or work, no longer having that can be really, really challenging. Increased isolation is also a huge factor. So whether this is about feelings of loneliness, so we know that loneliness is an emotion that often precedes symptoms. We also know that isolation and loneliness can impact other mental health challenges, thereby affecting eating disorder symptoms. So maybe being in isolation is making someone feel more depressed, which then contributes to symptoms. We also know that isolation can lead to a loss of accountability around food and meals. So for folks who were eating meals with others or had people to sort of hold them accountable for their recovery, this is now for a lot of folks lost if they are living alone or with people that they don't feel comfortable talking to. And conversely, living with others and not having a sense of privacy can also lead to an increase in symptoms due to a feeling of being out of control or being watched. So that's also something to consider. Next, discussions about food scarcity and hoarding can be really difficult, and this is something that's come up in our groups. This could, result in different symptoms for different people. So for some, these discussions can lead to compulsive or binge eating because of a fear that food will not be available later. So again, if we think back to the binge restrict cycle, it can be happening in the reverse effect. So worries about food scarcity. And at the same time, those same discussions or feelings can lead to restriction if a person feels like food might not be available later, and so I need to save it and therefore not eat it now. We also know that a lot of foods that folks are used to eating are not available right now, and so that can be really, really challenging. So in a stressful situation, then having to introduce new foods or different foods, that can be really hard. And lastly, immune function is something to consider. So while there is no current evidence that people with eating disorders are more likely to get COVID-19, we do know that many folks with eating disorders do have compromised immune function, which can then make a person more susceptible to illness. So something to consider as well. And again, this by no means is an exhaustive list of the ways in which COVID-19 intersects with eating disorders. I'm sure everyone here can think of many more ways in which that is happening. So I'll pause here before we move into the recommendations or strategies section to ask if there are any questions at this point. Okay, so I'll continue on for now. It doesn't look like there are any questions so far. All right, so the recommendations that I have here, when I was creating this presentation, again, I was trying to figure out, should I break this down into general recommendations and then COVID-19 situation recommendations? And then I decided that all of these strategies are helpful regardless of the situation, and I think they are especially important to remember now. So we're combining them all into one. Okay, I see one more question about the types of treatment. So why don't we'll go back to that at the end once we get through this stuff. So hang on to that question. Okay, so in terms of these recommendations as well, I just want to reiterate that given the fact that we work with folks who are ages 17 and older at Sheena's Place, this is where these recommendations are coming from. So these are meant to be more appropriate for supporting older adolescents or adults with eating disorders rather than younger adolescents and children. However, some of them are relevant to all types of folks or all ages. So the first, and some of these may seem really intuitive, and so I'm really not meaning to, I know that everyone here has so many strategies and so many amazing ways that they are already supporting their loved ones, but just some gentle reminders and additional context. So being patient is very important. And I know this can be so hard when all we want is for our loved ones to recover and to not be in pain. And so we want to sometimes rush this process. I myself am a very impatient person. So this is something that I would find quite hard myself. So when you do approach your loved one, whether it's for the first time or the 100th time, don't be surprised if they reject your expression of concern. They may even react with anger or denial. There can be so much shame and pain associated with having an eating disorder. And so sometimes those reactions are what that person needs to do in the moment to feel safe. Compassion and empathy, of course. So remember that your loved one is coping. They are doing the best that they can at this moment. And that even though eating disorder symptoms are something that we want to help someone recover from, that they reflect strength in that a person is doing their best to cope given the tools that they have. Your loved one is likely feeling a lot of different things. This could include fear, anxiety, and shame. And so validating these emotions is really important, as this is what's driving often the eating disorder symptoms and behaviors, rather than focusing on the specific symptoms and behaviors themselves, trying to dig a little bit deeper. seeking to understand what's going on too is really important, in a non-judgmental way. So it can be really hard not to jump to conclusions or make assumptions about what's going on based on what we're seeing. Um, but like I said earlier, often folks will go to great lengths to hide their symptoms. We also know that, based on some of the myths that I talked about earlier, that some of our assumptions aren't necessarily reflective of what's going on. So trying to stay curious with your loved one and ask them what's going on in as neutral of a way as possible. I know that's really hard because our biases and assumptions are going to automatically come out at times, especially when we're feeling emotional. But remembering too that your loved ones may hold different beliefs about health than you do, and so leaving space for discussion about that in as safe of a way as possible. Providing encouragement. This is about a couple of different things. Encouraging your loved one to see themselves as more than their eating disorder, emphasizing their strengths, even when they might feel like these don't exist. We know that everyone is more than their eating disorder, even though identity can get quite tied up in that. And also encouraging your loved one to seek support if they are ready. Not everyone will be ready, and we're going to touch on that in the next slide. Affirm that you are there to support your loved one, so remind them that you're there, and maintain other parts of your relationship with this person if possible. So I know that the eating disorder can really take over all aspects of life for a lot of folks. But trying to have other things to talk about, other hobbies or things to do, just to again remind yourself and them that your relationship is not only about the eating disorder and that it transcends those issues. Reflecting on our own beliefs and biases about food and bodies. This one is really hard. It takes a lot of work. We are all inundated with messages about food and about bodies. So for example, like I discussed earlier, around health at every size. And so this idea that thin bodies are healthy or fat or larger bodies are unhealthy, that's a really common narrative. And so unlearning some of that can be really beneficial to supporting our loved ones. And that can take a lot of time. It's hard to just change the way we think automatically. And so I will provide some more resources about that at the end. Noticing how we talk about ourselves and others as well. So again, this is something that can happen really automatically, but we know that language is powerful. And so the way that we comment on our own bodies and our own eating styles sends messages to others about how we feel about bodies and food and health. And so even if we, like I said earlier, we are all somewhere on that spectrum of disordered eating, whether it's on the far left where it was like, healthy relationship with body and food, or the right with the diagnoses. But know that, what we say has an impact. And so trying your best to model for your loved one what a healthy relationship with food looks like, without being, forceful or, with that empathy that we discussed earlier. Communication and boundary setting. So this is particularly important in the COVID-19 times that we are in. And I know this will look very different depending on everyone's individual situation. So whether you're living with your loved one who has an eating disorder, this can be incredibly stressful for everyone involved. And so in terms of boundary setting, it's important to, if you can, establish with that person maybe a specific time that you will or won't talk about the eating disorder, so that it doesn't permeate all aspects of life at home, since there isn't much of an escape right now. And if you're not living with the person, this can also be really hard. And so remembering to check in with that person, but to also give them space, and to really ask your loved one what they need. And they might not know what they need because this time is so unprecedented. We don't really have anything to base this on. And so again, that comes back to patience and listening and not making assumptions. When it comes to communication as well, using I statements is very helpful. So, for example, saying I am concerned or I am feeling sad, rather than more blaming or guilt tripping statements or ultimatums. So rather than saying you are really upsetting me or you are making me feel sad, it tends, for most folks in most situations, it tends to work better to use I statements. And then it's a bit harder for the other person to, debate what we're saying when all we're doing is speaking from our own perspective and not putting that on someone else. In terms of acknowledging and validating our own feelings too, this is so important, especially at a time that can be so stressful and difficult for so many people. And so doing your best to remind yourself that whatever you're feeling, that's okay. There's no wrong way to feel. And so just leaving some space for that can be, it sounds maybe simple or not that important, but it can have a big impact on how we're feeling and how we're able to care for others. And similarly, engaging in self-care for yourselves as well. So I think, when I say self-care, often people jump to scented candles and bubble baths. And while those things can be really important for relaxation and can be a part of self-care for many people, I also mean, self-care in terms of doing the things that maybe you're putting off or that you don't want to do, or that will benefit you in the long run. That includes therapy or support for yourself if that's available to you. And again, I'll provide some resources about that at the end. And just remembering too that, we can't pour from an empty cup. So it's really important for caregivers and loved ones to care for your own needs as well as caring for others, which is so much easier said than done. But just a reminder around that. And lastly, the stages of change. So this is something that we talk about in groups, both with caregivers and with folks with eating disorders. It can be a helpful way of kind of contextualizing recovery. And so I'll move through the stages, and then after this, we're on to resources. So essentially, the stages of change refer to a series of steps that we go through whenever we're making a modification or change in behavior. So this doesn't just refer to eating disorders. This model is often used for substance use, but it can be used truly for anything. So if I set the goal, like I want to go to sleep earlier, or I want to stop smoking, or whatever it is, this can apply. And so these steps in this model are not linear. A person can move through or between these steps many, many times. And so I'll briefly outline each step. So pre-contemplation is usually the start of where things happen. And in pre-contemplation, there's really no acknowledgement that there's a problem and no intention of seeking support or of changing. A person may be unaware of some of the risks associated with the behavior, or they might be in extreme denial. So remember, when it comes to eating disorders, that symptoms are serving some sort of function and represent coping. So if a person doesn't have other ways to cope with what's coming up for them, then there's going to likely be a lot of ambivalence or resistance towards change. And that's really, really common. Contemplation is then recognition that there is a problem and increasing awareness about that, but there's no intention of changing. So that might be a person saying, okay, I know that I am doing this eating disorder symptom. I know that it's probably not good for me and I probably shouldn't be doing it, but I don't want to change, or I'm not ready to change right now. Preparation, that stage is about believing that change will be beneficial and preparing to take action and planning to do so. So that could be doing a Google search of eating disorder supports. Maybe it's registering for a group at Sheena's place, but not quite being ready to attend it. And then action is actively working towards recovery. And so maybe that's attending groups at Sheena's place. It's using the skills and strategies that we're being taught. And then maintenance, like it kind of is self-explanatory, maintaining or sustaining changes over time. And again, a person may move, between these in a different order than I just explained. So someone could move from pre-contemplation straight to preparation, and then back to contemplation, and then into action. So it really, there's a lot of movement, and that's really a really normal part of recovery. It's not, if a person returns to pre-contemplation, it doesn't mean that they have given up or that they are starting from the beginning again. This is really part of the process. And what this does is it allows a person to figure out what works for them and what doesn't. And I also want to point out that COVID-19 may be triggering this for quite a few people. So it might be triggering what some people refer to as a relapse or a lapse in symptoms. And this, again, is so understandable. And something that we have been telling folks in our groups is that, right now, during COVID-19 isn't necessarily going to be the best time to create new goals and to try to move through to another stage in the cycle. Despite what society is telling us about productivity and all this time that we have, it really, maintaining where we're at right now is likely the best strategy. All right, so I'm going to move into resources. Thank you so much for listening so far to all of that. We are almost through. So the first page of resources here is for folks with eating disorders. And so all of these and all of the slides about resources, everything that's blue is hyperlinked. And so when you get the link to these slides, you'll be able to just click through and it will direct you to each website. So as I mentioned earlier, Sheena's Place is providing some virtual support. Currently our groups are full, but we do have wait lists, and we hope to increase our availability in the future. So please just keep checking back for your loved ones. Below I have listed a few different organizations who are also doing virtual treatment or support, mostly group-based. A couple that I'll point out include the Trans Folks Fighting Eating Disorders Resource Network. They also have a Facebook page that acts as a peer support environment. And Algona Positivity Pride hosts a monthly peer support group for the Black, Indigenous, and people of color community. And this information can be found on their website as well. Balance Eating Disorder Treatment Center is a New York City-based treatment center. It is private treatment. In full transparency, I do not know how much it costs, as the fees are not online, but I know that they've converted pretty much everything to virtual if you're interested in checking that out for your loved one. A couple of other helpful resources include NEDIC, so the National Eating Disorder Information Center. They're a Canadian organization based in Toronto that essentially has a service provider directory on their website where you can look up therapists and support and treatment programs all across Canada. They also have a toll-free helpline and an anonymous chat where caregivers, individuals who have eating disorders, and medical professionals can reach out to ask any questions that they have. Another helpful resource is the Ontario Community Outreach Program for Eating Disorders, or OCOPED. They provide training and education for mental health and medical professionals, and they also list all of the publicly funded eating disorder programs in Ontario. I will say that right now, while most inpatient programs are still open, they are not accepting new patients. And most of the outpatient programs have closed, unfortunately, due to COVID-19. So now may not be the best time to be looking at the publicly funded hospital programs in Ontario, but for when this situation is over, that is a resource at your disposal. OHIP also has an agreement with a few different out-of-country eating disorder programs, I think both in the US. So that's something to look at, again, not for the current climate we are in, but for after all of this is over. And the last two resources there are a couple of different handbooks that our clients have found helpful so far to cope with this time. Now for caregivers and loved ones, here is a list of resources. As I mentioned earlier, Sheena's Place is starting a virtual support group for caregivers. So this will begin next week. Registration is required, and that can happen through our website. Capacity is limited for this group. And so folks do need to register beforehand and agree to our service user agreement, and you'll get all sorts of materials when you do register. If you have any other questions about that, I'm happy to answer them. The other organizations listed there also provide virtual group support for caregivers. One that I will add to this list is Danielle's Place, based in Burlington. They're also offering a free virtual support group for caregivers. Below are a few general mental health resources that you're welcome to check out. Again, these are hyperlinked, so more information is available. And then lastly, I just want to point out a couple of eating disorder advocacy organizations. for caregivers. So the National Initiative for Eating Disorders is one. They are amazing. They do a lot of advocacy work, so please check them out. As well as Feast. They're a global organization. They have online peer support. They also engage in advocacy, and they have a COVID-19 resource page on their website, which is really great. So I would highly recommend checking that out. And lastly, I will say that a lot of the content from the second half of this presentation is based on NEDIC's Parent and Caregiver Guide to Supporting Youth with Eating Disorders. So if you want to check out their full guide, you can click on that link and it will take you right there. Lastly, a few additional resources. So a few resources that I found specifically related to COVID-19 that I found really helpful, as well as more general eating disorder resources if you want to learn more about specific diagnoses, symptoms, health consequences, all of that. And then lastly, more resources about health at every size and weight stigma. Okay, that was a lot. Thank you so much for listening, everyone. We have about 10 minutes, so any questions at all, feel free to send them in the chat or to ask them verbally. We'll hang around for the next 10 minutes. If you do need to leave, you're welcome to do so. So thank you so much for listening. I really appreciate everyone taking the time to do that today.
Hey everyone. I will jump in with one additional resource recommendation related to an earlier question about feeling cold. There's a great book called Sick Enough. It's written by a doctor named Jennifer Gaudiani. This is a guide to the medical complications of eating disorders, and it's a very well-written book with a lot of explanations about some of the medical complications that folks may be experiencing. To answer the earlier question, again, I'm not a medical professional, but we had a medical professional share with us in the group, as well as what's shared in this book is that when folks are experiencing restrictive symptoms, basal metabolic rate will lower, which means that the number of calories that the body is burning to do basic bodily functions will lower. And that's in order to prioritize essential bodily functions. And so that can affect things like how the body regulates temperature. Blood pressure will drop and blood flow to the hands and feet will reduce. So that could be part of the reason why folks may feel cold if they're experiencing restrictive eating disorder symptoms. So that's explained in this book, as well as many other things or questions that folks might have.
Thank you, Kelsey.
I think we also had a question about what the purpose of CBT is for. So again, with transparency, I don't have a lot of specific CBT training, but like many other folks in the field, I use some tools from CBT. So CBT is cognitive behavioral therapy, my apologies. And so it's meant to examine the relationship between cognitions or thinking and behaviors. So it can help folks to understand if there are unhelpful thinking patterns that are contributing to behaviors that they want to change. Kaitlyn, I don't know if you have additional thoughts to add about CBT.
Yeah, so just essentially what you said, it will look different for everyone depending on their symptoms and their situation. But CBT can be helpful for reevaluating a person's thoughts about their weight and about their shape and their body image, and reducing negative feelings and harmful behaviors. So it's a combination. I know that's really vague, but it would really depend on the person. And I also see a question here about the resources. So you will, right at 11:30, so in 5 minutes, you will receive an email from Eventbrite, and it will have a link to the slides, which has all the resources on it, as well as a link to an evaluation that I would really appreciate if everyone could fill out, just so that we can improve this presentation in the future and improve our outreach initiatives in the future. Okay, and I see one more question here. Is group therapy more effective than individual therapy for eating disorders? I've heard a lot about group therapy for eating disorders. That's a great question. I would say that it really depends on the individual. Some people love groups and feel that They help reduce isolation and loneliness, which are very common for folks with eating disorders. And, you know, just the feeling of being heard and understood by other people. But for some people, group settings are really anxiety provoking and are not all that helpful. Some folks find that they can promote a lot of comparison that goes on. And so this can sometimes not be as helpful for the eating disorder, or depending on where the person is in their recovery. So I would really say that it depends on the individual, but research shows that both individual and group therapy can be effective in treating eating disorders. Okay, and a question here. I understand that you addressed that Sheena's Place doesn't offer treatment, but could you please elaborate in your personal knowledge? What could ED treatment consist of? Yeah, so thank you for that question. So again, based on my knowledge, thank you for disclaiming with that. Treatment can look really different depending on what type of treatment it is. So here we've outlined, you know, the different treatment environments. And, you know, an inpatient setting, for example, is going to have more medical components than an outpatient setting. So refeeding, so really like hooking someone up to a feeding tube and engaging in a lot of like medical interventions in that way. Whereas, you know, more outpatient settings would mostly include psychotherapy, perhaps nutrition counseling, and that sort of thing. So if we look back here, these are the components of a lot of treatment programs. I can't really speak to the structure of like what a day in treatment looks like. Again, that will depend on the treatment setting. So I would encourage you to reach out to different treatment settings, or even to NETIC. They may be able to provide more information about that specifically. Okay, I see one question here. When the patient is engaging in binge eating, how to help and what to say? Again, a very good question. I think that, you know, if we look back to some of the strategies here, I think that focusing on what is the emotion or the reason behind the binge is likely going to be more effective than focusing on the binge itself. So instead of asking the person like, how much did you eat, or what did you eat? Asking like, how are you doing? You know, what's going on with you? Because if we can focus more on those underlying emotions, then maybe we can help the person develop alternative coping strategies. And I think in this case, the non-judgmental attitude is really important, because especially with binge eating, there can be a lot of guilt and shame associated with it. And so, you know, showing any signs of disgust or of you know, judgment as a caregiver or a loved one can be really hurtful to the person who is struggling. So, you know, doing your best to not show any of those judgments or feelings. I hope that's helpful. But I can't really give specific advice, you know, because every situation is different.
Hello, hi.
Hi.
Just something that it helps a lot during the pandemics, when everyone is at home and doesn't have the interaction with other people. There is this therapy. Some people believe it or some they don't, but if they don't, they should try it. It's called EFT tapping. You can Google search, you can find a lot of information. It's a self-therapy and it acts on reducing the stress, and it's also helping for weight management, for addictions, eating disorders, reducing the stress. And during this period of stress with pandemics, it helps with pretty much everything, and it's very easy method. So if anyone is interested, they can just Google search EFT tapping. Lots of resources, and it's very useful.
Thank you so much for sharing. I have also heard of that, and I really appreciate you sharing that with the group. So yeah, feel free to look into that if that is of interest to anyone. It is 11:30 now, so we are going to end the webinar. You have my contact information through Eventbrite. If you have any other questions, please feel free to send me an email. I would love to hear from you, and I really appreciate everyone taking the time today. So if you could fill out that evaluation, that would be awesome. We would love your feedback, and I hope that everyone has a great rest of their day, and I wish everyone all the best with supporting themselves and their loved ones in the current context. So thank you and goodbye.
Goodbye. Thank you.